Have you ever been caught off guard by a fart so sneaky, so loud, or so downright stinky that it left you red-faced, clutching your belly, or blaming the dog? Maybe it's that sulphurous whiff that lingers like an uninvited guest, the explosive machine gun blast that startles everyone in the room, or the silent crampy puff that hits with a wave of pain. Ladies, we've all been there, and it's time to talk about it. No shame, no sugarcoating. These aren't just awkward moments. They're your body's way of sending signals, and ignoring them could mean missing something serious. In this video, we're diving deep into what those farts, whether smelly, loud, or sneaky, might be telling you about your health, from diet tweaks to red flags like IBS or even colorectal cancer. You need to watch until the end, because we're sharing practical steps you can take right now to listen to your body. Take charge of your health and live with confidence. No embarrassment required before we begin. I would appreciate it if you like this video. You can help me continue to share the valuable lessons of old age. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment. Number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. 1. The sulfur stink that lingers, ladies. Let's have a real no-nonsense talk about that. Sneaky, sulfurous stink that lingers in the air like an unwelcome guest at a garden party. You know exactly the kind of fart I'm talking about. The one that hits you with a wallop of that thick, eye-watering rotten egg odor that could clear a room faster than a fire alarm. It's the kind of smell that makes you want to fling open every window light, a dozen scented candles, or point an accusing finger at the dog, the grandkids, or even that old couch that's been in the family since the Nixon administration. But deep down, you know the truth. You know exactly where that stench is coming from, and more importantly, you need to understand what your body might be trying to tell you when it unleashes these pungent offenders, that distinctive sulfur smell. The one that seems to hang in the air like a bad memory usually comes from a gas called hydrogen sulfide produced in your gut during digestion. Now, don't get me wrong. An occasional stinker is as normal as forgetting where you parked your car at the supermarket. Certain foods are notorious for causing these aromatic eruptions. Think eggs, broccoli, cauliflower cabbage, or those mouth-watering sausages you couldn't resist at the bowling club buffet. Even red meat beans or a particularly indulgent helping of garlic bread can lead to a toot that smells like it belongs in a chemistry lab. These foods are high in sulfur, containing compounds like methionine or cyan, which your gut bacteria break down into hydrogen sulfide. A little whiff, now and then, no big deal. Your body is just doing its thing. But when those sulfurous farts become a regular occurrence, say multiple times a day, and the smell is so potent it could peel paint off the walls, or make your bridge club rethink their seating arrangement, that's when you need to sit up and take notice. Persistent foul-smelling gas that lingers like an unwanted house guest could be your body's way of waving a red flag about something going awry in your digestive system. Doctors point to a few possible culprits when the stench becomes a chronic issue, and it's worth understanding them so you can take charge of your health. One potential cause is malabsorption, which is a fancy way of saying your body isn't breaking down or absorbing nutrients from food properly. This can happen for a variety of reasons. For instance, lactose intolerance, where your body struggles to digest the sugar in dairy products, can lead to excessive gas production, often with that telltale sulfur smell. If you've been indulging in ice cream or creamy casseroles and notice bloating, cramps, or diarrhea alongside the stink, lactose could be the culprit. Similarly, celiac disease, an autoimmune condition triggered by gluten, found in wheat, barley, and rye, can wreak havoc on your gut, leading to foul-smelling gas, diarrhea, and even nutrient deficiencies. If left unchecked, another possibility is a gut infection like giardiasis caused by a pesky parasite you might pick up from contaminated water or food. This infection can cause gas that smells like it belongs in a swamp, along with nausea, fatigue, and abdominal pain. But it's not just about what you're eating or what's infecting your gut. Sometimes the issue lies deeper. Chronic conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, can alter how your gut processes food, leading to excessive gas production and that distinctive sulfurous odor. And while it's not pleasant to think about, we need to talk about the more serious possibilities in rare cases: persistent foul-smelling gas, especially when paired with symptoms like unexplained weight loss. Blood in your stool or changes in bowel habits could be a warning sign of colorectal cancer, particularly in women over 60. I'm not saying this to scare you senseless, but to arm you with knowledge. Colorectal cancer is one of the most common cancers in women, and early detection can be a lifesaver. Now I know what you might be thinking. It's just gas. Everyone farts. Why make a big deal out of it? And you're not wrong. Farting is a natural part of being human. The average person passes gas 5 to 1, chapter 5 times a day, and most of the time it's harmless. But too many of us, especially women of a certain age, were raised to sweep things under the rug, to be polite, to avoid talking about our bodies, especially the less glamorous parts. We were taught to smile through discomfort, to ignore the signals our bodies send us, and to never ever admit to something as unladylike as a fart. Well, ladies, I'm here to tell you that at this stage of life, we don't have time for that nonsense. Your body is a remarkable machine, and when it starts sending you signals, whether it's a sulfurous stink, bloating, that makes your pants feel like a torture device, or bowel changes that just don't feel right, it's time to listen. Let me tell you about my dear friend Margaret, who learned this the hard way for years. Margaret brushed off her chronic gas as just a sensitive tummy. She'd laugh it off at our weekly book club, blaming her famous chili recipe or the occasional glass of milk. But her house started to smell like a sulfur mine, and her husband, bless his heart, finally convinced her to see a doctor. Turns out she had a condition called small intestinal bacterial overgrowth, SIBO, where an overabundance of gut bacteria was fermenting food in her small intestine, producing excessive gas with that telltale rotten egg smell left untreated. SIBO could have led to nutrient deficiencies or even more serious complications, but with a course of antibiotics, a few dietary tweaks, like cutting back on fermentable carbs and a daily probiotic, Margaret was back to her vibrant self. Her living room no longer smelled like a chemical spill, and she felt better than she had in years. So what should you do if your farts are knocking people out like tear gas first? Don't just reach for the air freshener or try to pin it on the cat. Start by keeping a simple food and symptom diary for a week or two. Write down what you eat when you notice the gas and any other symptoms like bloating, diarrhea, or abdominal pain. This can help you spot patterns. Maybe dairy or gluten is the trigger, or perhaps that new high-fiber smoothie is wreaking havoc. Next, consider making some dietary tweaks, cutting back on sulfur-rich foods like eggs, meat, or cruciferous veggies, broccoli, cabbage. Brussels sprouts might help if you suspect lactose intolerance. Try swapping regular milk for lactose-free options or plant-based alternatives. Adding a probiotic supplement or fermented foods like yogurt or kefir can also help balance your gut bacteria, reducing gas production. But if the problem persists, say you're still dealing with frequent foul-smelling gas after a few weeks of dietary changes, or you're noticing other red flags like unexplained weight loss, blood in your stool, or persistent diarrhea, it's time to call your doctor. Don't let embarrassment stop you. Doctors have heard it all, and they're there to help, not judge. They might recommend tests like a breath test for SIBO or lactose intolerance, a stool test to check for infections or malabsorption, or even a colonoscopy to rule out more serious conditions. Especially if you're over 50 or have a family history of colorectal issues, the American Cancer Society recommends regular colorectal cancer screenings starting at age 45, so if you're due for one, this is a great time to get it scheduled. Here's the bottom line. Your body is talking to you, and those sulfurous farts might be its way of shouting for attention. Don't ignore it. Don't be embarrassed, be informed. Be proactive, and take charge of your health. You've earned the right to feel good, to enjoy your days, without worrying about clearing a room, and to live your life to the fullest. So the next time that rotten egg smell was up, don't just laugh it off or blame the dog. Listen to your body and give it the care it deserves. You've got this, ladies. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. The explosive loud machine gun fart. Now let's talk about the kind that doesn't stink up the place but shakes the furniture. You know, the one it builds up slowly. You're sitting in church or at a quiet dinner and suddenly it lets loose like a trumpet. Solo, loud, startling, and sometimes a rapid-fire series, like a machine gun. You didn't even mean for it to happen. 1 second you're sipping tea, the next. You sound like you're starting a Harley Davidson now. While loud gas by itself isn't necessarily dangerous when it becomes frequent, like multiple times a day, especially after meals, and comes with a bubbling or cramping sensation in your gut. Doctors say that could point to something deeper. Often these explosive bursts of gas are caused by excess fermentation in the gut. And that's not just about eating too many beans or Brussels sprouts. It could be related to food intolerances, or even a digestive condition that needs attention. For instance, lactose intolerance becomes more common as we age, even for those of us who once drank milk straight from the bottle. As kids, gluten sensitivity can also creep in over time, and in many cases the culprit is something called SIBO, small intestinal bacterial overgrowth, which means the wrong bacteria are partying in the wrong place, producing way too much gas. These farts aren't just noisy. They often come with bloating, unpredictable bowel movements, and a feeling like your stomach is a balloon ready to pop if you've ever had to unbutton your pants halfway through a meal, just to breathe. You know exactly what I mean. The tricky part is that we often laugh it off. "Oh, I've just got a gassy tummy," we say. Or "That's what I get for eating cabbage." But when those explosive sounds become a regular part of your day, and especially if they're accompanied by abdominal pain or urgency, it's time to stop laughing and start investigating. And can I just say, from one woman to another, there is nothing shameful about asking for help. When your body is acting up, we check our blood pressure. We take our vitamins, we get mammogs. Why wouldn't we take our digestion seriously too? So the next time your backside starts sounding like a jazz percussionist, don't just chuckle and move on. Pay attention, keep a food journal, see a dietitian. And if your gut's making more noise than your grandchildren, it might be time for a chat with your GP. 3. The silent but sudden gas with cramps. Let's talk about the kind of fart that catches you completely off guard. The silent, stealthy kind that slips out without a sound, a smell, or even a rumble. To warn you, one moment you're sipping tea, chatting with a friend, or standing in line at the grocery store, feeling perfectly fine. Next, your insides twist like someone wringing out a wet dishcloth, and a wave of gas escapes so quietly you almost question whether it happened. Then the cramp hits, a sharp, twisting pain that radiates through your abdomen, leaving you clutching your belly or doubling over, wondering what just ambushed you. This isn't just a harmless puff of wind. It's a sneak attack that can leave you rattled, embarrassed, and frankly a little scared. These silent but painful gas episodes are more than just an awkward moment. They can be a red flag waving frantically for your attention if you're experiencing frequent gas, accompanied by sharp, crampy pain or a sudden urgent pressure that sends you sprinting to the bathroom. It's time to consider that something more serious might be at play. One of the most common culprits is irritable bowel syndrome, IBS, a chronic condition that affects the large intestine and can significantly disrupt your quality of life. IBS isn't just a fancy term for a stomachache. It's a complex disorder that can cause a constellation of symptoms, including bloating, unpredictable bowel habits. One day you're constipated, the next you're dealing with diarrhea, and those sharp, unpredictable waves of gas that seem to strike out of nowhere. IBS is more common than you might think, affecting up to 15% of adults worldwide, with women being diagnosed more frequently than men. Unfortunately, women, especially older women, are often dismissed when they bring up digestive complaints, as if abdominal pain is just something to live with as we age. That's nonsense, and you deserve better. These silent, crampy gas episodes can be triggered by a variety of factors, including diet, hormonal fluctuations, and perhaps surprisingly stress and anxiety. The gut-brain connection is real and powerful. Your digestive system is lined with millions of nerve cells that communicate directly with your brain, forming what's often called the second brain when you're stressed. Whether it's about family, finances, or health, your body holds on to that tension, and your gut often becomes the stage where it plays out. I'll share a personal story to illustrate this. A few years ago, I went through a particularly stressful period when my husband was dealing with a serious health scare between juggling his medical appointments, keeping the household running, and trying to stay strong for our kids. I was a bundle of nerves every evening like clockwork. I'd feel a deep twisting cramp in my lower abdomen, followed by a silent release of gas that brought momentary relief but left me confused and anxious. Was it something I ate? Was my body betraying me? It wasn't until I saw a gastroenterologist that I learned my stress was essentially clenching my gut. Triggering IBS-like symptoms, the doctor explained that stress can slow digestion, increase gut sensitivity, and even alter the balance of bacteria in your intestines, leading to those painful, sneaky gas episodes. If you're dealing with these silent but painful farts, here's what you need to know. Track your symptoms. Start a journal to note when these episodes occur. What you ate, your stress levels, and any other symptoms like bloating, diarrhea, or constipation patterns can help your doctor pinpoint the cause. For example, certain foods like dairy beans or high FODMAP. Foods like onions, garlic, or wheat can trigger IBS symptoms. In some people, consider stress management, since stress can exacerbate gut issues. Try incorporating relaxation techniques like deep breathing, yoga, or meditation. Even a 10-minute walk can help calm your nervous system. And by extension, your gut dietary adjustments work with a dietitian to identify potential trigger foods. A low FODMAP diet, which reduces certain carbohydrates that are hard to digest, has been shown to help many people with IBS. Avoiding artificial sweeteners, like sorbitol or carbonated drinks, can also reduce gas buildup. See a specialist if these episodes are frequent or interfering with your life. Don't hesitate to consult a gastroenterologist. They may recommend tests like a colonoscopy, stool analysis, or breath tests to rule out other conditions like small intestinal bacterial overgrowth, celiac disease, or inflammatory bowel disease. IBD medications and therapies for IBS treatments range from over-the-counter remedies like Cithicon for gas to prescription medications like antispasmodics or low-dose antidepressants to calm gut sensitivity. Cognitive behavioral therapy, CBT, can also help manage the stress component. The bottom line: these silent, crampy gas attacks are your body's way of saying, "Pay attention to me." Don't brush them off or let embarrassment stop you from seeking help. You deserve to live without the constant fear of when the next cramp will strike, or whether you'll be caught off guard in public. Talk to a doctor, track your symptoms, and take control of your gut health. Your body and your peace of mind will thank you. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time for the leak. You didn't feel the troubling whisper of incontinence. Now let's get real about something even harder to talk about: the faint, barely there puff of gas that sneaks out without any warning, leaving you horrified when you realize it's happened sometimes because someone else noticed first, or worse, because you feel a tiny bit of warmth or dampness where it shouldn't be. This isn't your average run-of-the-mill fart that you can laugh off or blame on the dog. This is gas incontinence, a condition where your body releases gas without you feeling the urge or having any control over it. And let's be honest, it's mortifying. No one wants to admit they've had a leak, but we're grown women, and it's time to break the silence and address this head-on. Gas incontinence is more common than you might think, especially as we age. It's often linked to pelvic floor dysfunction, which can result from a variety of life experiences. Childbirth, pelvic surgeries like hysterectomies, prolonged sitting or standing, heavy lifting, or even the hormonal changes of menopause that weaken connective tissues. The pelvic floor is a group of muscles and tissues that act like a sling supporting your bladder, rectum, and other pelvic organs. When these muscles weaken, you may lose the ability to sense or control the release of gas, leading to those unexpected silent leaks. But it's not just about weak muscles. Gas incontinence can also be a sign of more serious underlying issues. For example, nerve damage from conditions like diabetes, multiple sclerosis, or even spinal injuries can disrupt the signals between your brain and your rectum, making it harder to sense when gas is about to escape. In some cases, gas incontinence can be a symptom of rectal prolapse, where part of the rectum slips out of place, or anal sphincter dysfunction, where the muscles that control the anus don't close properly. If you're also noticing stool leakage, difficulty wiping clean after a bowel movement, or a sensation of incomplete evacuation, these could all be part of the same issue. I once knew a woman named Eleanor, a vibrant 68-year-old who loved tending her garden and hosting her weekly garden club meetings. But over time, she started pulling back from those gatherings, making excuses about being too busy. It wasn't until we had a heart-to-heart that she confessed her fear. She was terrified of letting gas slip out without realizing it. Especially after a few mortifying incidents at social events, the shame was crushing her confidence, and she'd started avoiding the activities she loved. It broke my heart to see her retreat from her passions. Thankfully, after she opened up to her doctor, she discovered there were solutions: pelvic floor, physical therapy, dietary changes, and even medications that helped her regain control and confidence. Here's what you can do if you're experiencing gas incontinence. Consult a specialist. Start with your primary care doctor or a gastroenterologist. But don't be surprised if they refer you to a colorectal surgeon or a pelvic floor specialist. They may perform tests like an anorrectal manometry to measure sphincter strength, or imaging to check for structural issues like prolapse. Pelvic floor therapy. A physical therapist trained in pelvic health can teach you exercises like Kegels to strengthen your pelvic floor. Biofeedback therapy, which uses sensors to help you retrain your muscles, can also be highly effective. Dietary changes. Certain foods like beans, broccoli, or carbonated drinks can increase gas production, making leaks. More likely, a dietitian can help you identify triggers and create a plan to reduce gas while maintaining nutrition. Medications and devices. In some cases, medications like liramide can help regulate bowel movements and reduce urgency for severe cases. Surgical options like sphincter repair or sacral nerve stimulation may be considered lifestyle adjustments. Avoid straining during bowel movements, as this can weaken the pelvic floor. Further, stay hydrated. Eat fiber to prevent constipation, and consider timed bathroom visits to reduce pressure on your rectum. Mental health. Support. The embarrassment of gas incontinence can take a toll on your mental health, leading to anxiety or social isolation. Talking to a therapist or joining a support group can help you cope and rebuild your confidence. The most important thing to know is that you're not alone, and you don't have to suffer in silence or shame. Gas incontinence isn't your fault, and it's not something you have to just live with. There are treatments, therapies, and strategies that can make a real difference if you're tensing up every time you stand, bend over, or laugh, worried that something might slip out. Please reach out for help. You deserve to live with confidence, free from fear and fully engaged in the life you love. Talk to a doctor. Explore your options and take that first step toward reclaiming your freedom. Thank you so much for joining me today for this honest, eye-opening conversation. about our bodies and those unexpected moments that catch us off guard. I hope you've learned something valuable about listening to your body's signals. Whether it's that sulfurous stink, those loud machine gun bursts, the silent cramps, or the troubling whisper of gas incontinence. These aren't just embarrassing moments. They're your body's way of asking for attention, and you deserve to feel confident and in control, so I'd love to hear from you. What's one thing you've learned from this video that you're going to bring into practice in your life? Maybe it's keeping a food diary, trying a new relaxation technique, or scheduling that doctor's appointment you've been putting off. Drop a comment below and share your thoughts. It might just inspire someone else to take charge of their health too. If you found this video helpful, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel for more no-nonsense health talks. Let's keep this conversation going and support each other in living our best, healthiest lives. Until next time, take care of yourself. You've got this.